What if you found out your surgeon operated on another patient while operating on you at the same time? Called concurrent surgery, some hospitals double book specialty surgeons to save time and money. These busy docs go back and forth between operating rooms while leaving general surgeons or trainees to pick up the slack. And most of the time, the patient is not informed or aware of this policy. Is this an efficient use of a surgeon's time or potentially a multitasking nightmare that puts patients at risk?
You know, I have to say, Drew and I know, because we've been in this world, and it's different in every hospital, it's different for every surgeon, every specialty is different. I made a rule for myself when I was finishing my residency, when I came out into practice and I performed surgery. My patients do not get put to sleep unless I am in that OR with them, holding their hand, mask down, and they can look me in the eye and say, my doctor is here, my surgeon is with me. That's my style, that's my own rule.
100%. When they go to sleep, we have to be there, and we also have to be there at some point when they wake up.
Right.
And tell them how everything went. But to book surgeries like this happens all the time, and it is more efficient. It's more efficient for everybody. The surgeon, the next patient, you wait less, you go without eating NPO, less time, and you know, you have to be upfront about it going into it, saying, I do all of your surgery. I did all the markings, all the key maneuvers I will be doing, but yes, I have people who help me with suturing, who help me with bandages, things like that.
And what you're saying, I think, is important. It's that this practice isn't inherently bad or dangerous. The problem is when you're the patient and you have no idea whatsoever that during your surgery, your surgeon may be in another room and going back and forth. So what do you do as a patient then? If you're not, maybe you're not comfortable with this or you're not sure, what do you ask? What signs do you look for? I mean, if you're seeing a surgeon and they seem disengaged, is that a worrisome sign?
I don't think it's a matter of their personality. I think it's very simple for patients who are undergoing surgery to ask their surgeon, take me through step by step what's going to go on from when I get wheeled out of pre-op or the holding area and when I come out of the OR into the recovery room. Walk through that with me.
And are you doing all of it? And if you're not doing all of it, what parts are you doing?
And I think the important part is you and I know, and as you know from doing this rotation in medical school, there's a lot that goes on in the OR that's not surgery. There's a lot of work the anesthesiologist does. There's a lot of prep work that sometimes a scrub nurse does or an intern or resident does. There's a lot that goes on that's not the actual critical part of the
patient, prepping a patient, all of those things. The surgeon can be in another room. I guess a thing came up with spine surgery. There was a question, spine surgeon running 2 rooms, and I guess it would appear that the spine surgeon was not there for a key component of the spine surgery in one of the rooms. That is not good.
But I think by and large, obviously, you know, I don't spend my time in the operating room because I'm in the ER, but I would like to think that every surgery I've ever been a part of way back in my training, you know, I was never in one where I felt like the surgeon wasn't there during the critical parts of the surgery. So overall, I would like to assure people that it's not as though they're sitting there, you know, splayed open to the world, and people are in there just dancing. Like, I just don't want people to be so terrified if you're going in for a surgery.
One specialty that really bangs them out, orthopedic surgery, scope. They usually have a PA or several PAs. Those people are trained to do, when that surgeon leaves that room, those people that are still there to whether place a stitch or put them in a dressing or cast, they are well trained.
And ultimately, you're responsible, whether you're in the room or not, and you know what's going on in that's your room, that's your case. You're responsible, but it really is a choreographed, almost like an orchestra or a ballet, because the anesthesiologist is in charge of the critical part before and at the end of the surgery, and sometimes it's just not feasible for the surgeon to be there, you know, like I am. That's my thing, because I don't stack a lot of surgery back to back.